The Member of Parliament for Lavantille West, the Honourable Fitzgerald Hines, and the Mover Seventh-day Adventist Church will be bringing to you a grand health fair. And to tell us more about it, no stranger to the show is Dr. Jevon Rush, joining us this morning on Now. Good morning and welcome back.
Hey, good morning. Good morning, Trinidad and Tobago.
Every time you're here, it's news of health and ways that we can access wellness therein. So I'm glad to have you on, but hoping that we get a little bit more insight on this exceptional event that is promising quite a lot of services. Now, first off, I'm not sure if the flyer will go up eventually, but we're talking everything from blood pressure testing all the way up to vaccines. This means that it's going to be a very intense day, and so tell me location and time, since it's a lot to cover.
Right, so the location is at the Morvant Lavantille Secondary School, and the time is scheduled to start at around 9 a.m. And as you mentioned previously, we're really taking a multidisciplinary approach to the patient, meaning that the common school of thought is that a patient comes and they have their basic investigations like the blood pressure and the cholesterol done.
Right.
But we're trying to elevate that idea to the point where we have more in-depth testing. For the woman, we're going to be offering a plethora of specific investigations from pap smears, breast examinations. And for the men, as we know from the previous presentations on the show, we're definitely going to be targeting things like the prostate, right? But besides investigating the individual as a patient, we also want to spread health information. So we're going to have things like first aid demonstrations and CPR classes as well on site by actual licensed EMTs. So we're really looking forward to persons coming out and engaging us this time around. So far, we've had a good rapport that we've been building with the nation, and we expect a very good turnout this Sunday.
I do too, because in terms of even that certification, first aid, at least the demonstrations, there is first aid certification available as well there and then. And that's a really strong asset to have, regardless of industry, because we need to be safe. I think that it's also interesting that there will be mental health, wellness, advocacy and conversations. What shape will that take?
So we're going to have psychologists as well as psychiatrists on the compound, and when we talk about health, a lot of the focus is placed on the physical component of health.
Right.
But we often misplace the importance of the mental component of health as well. Because health, as a multifaceted structure, it involves spiritual as well as mental as well as physical. So really want to offer the patrons of the public this one-stop shop where they could come and seek their holistic well-being.
Now, one of the things that caught my eye was also the endurance test, because it's not something I have. What does that look like?
So the endurance test is almost something similar to a stress echocardiogram, which is where the heart, when it's at the resting rate, it doesn't really show all the abnormalities in certain cases. So for us to expose those abnormalities that may be hidden, we actually have you engage in some form of physical activity, and therefore we're able to provide a more holistic report with respect to the heart function. And I agree with you, endurance isn't my best facet as well, but it's something that we need to have pinpointed down in Trinidad, because endurance is part of cardiovascular and physical health, and when you have those things lapsing a bit, you open up the doorway to developing things like the non-communicable diseases, which are really things like the pressure, the sugar, cholesterol and whatnot, which form a platform to developing the more serious diseases later on.
And those are the ones we see very prevalent in our communities. So that is an excellent in-depth, or more in-depth, approach that you guys are taking. Tell us a little bit as to who are the healthcare providers that will be there, though, because this is a big endeavor.
So it's a big endeavor, and we've had persons from the North Central Regional Health Authority there, so that's the public health sector being involved. But it's also an amalgamation of private entities as well. Most of the health services are going to be provided by the Community Hospital of Seventh-day Adventists. Now, they have been pivotal with the previous endeavors we've taken on, and they maintain that position. We're also going to be having people like the Wright Optical, Dalton Optometrist as well. We're going to have the QPCC, which is the Queen's Park Counseling Center as well. We're also going to have the Stroke and Diabetes Center, because as we know, we have a large burden of stroke affecting our countries, and that stems from, again, the platform of diabetes, pressure, sugar, leading to these diseases. So we have a lot of parties coming together, and it's all for the benefit of our public. So guys, come out, let's get to know our numbers, let's engage our healthcare practitioners, let's engage our mental health practitioners as well, and seek our best interest.
I'm glad that you used the term "guys come out" because one of the things that we always have to touch on is that prostate exam and how uncomfortable it can be for men, not just physically, but also intrusive in many ways. So let's demystify, for those who may have missed the previous conversations, some of the concerns that men may have about doing this in a seemingly public space.
So what I would say is that the general concept or the general school of thought with respect to the prostate testing in the past has been, once you're at 45 years and older, you need to come in and have that finger examination done. And that would have been completely true 10 to 15 years ago. But as medical technology progresses, we've had the advent of the prostate-specific antigen, or the PSA blood test. And this is a blood test that looks at a protein that's released from the prostate from a man, and it's able to tell us about 3 diseases specifically for men. It tells us about your risk of prostate cancer. It also tells us about your risk of having a large or swollen prostate, as well as an infection or inflammation of the prostate. Now,
without any sort of intrusive, invasive...
Correct.
Oh, wow, okay.
So a lot of the men would say, well, doc, is it that once we do the blood test, we're good? So there's a reference range, meaning a limit we'd like that blood test to be under, which is the number 4. If it comes back greater than 4, the next step isn't that we go do the finger next. It's that we have the advent of things like a multi-parametric MRI, which is a special MRI that is designed to look at this prostate disease at the smallest level, right? So if we do need to investigate further, the finger isn't usually the next step. We have MRIs. I want guys to understand that we all have a prostate as men. We can't get away from it. After the age of 45, it is going to grow. So instead of you going into the treatment mode, let's go into the prevention mode and present early for these types of tests.
Beautifully put. Now that means that all of these things are available to persons who are attending the health fair as well.
Definitely.
So all they need to do is come on down and engage with their health professionals, healthcare professionals, to get that insight.
Yeah, I would say just have a good sleep, have a good breakfast, come down, because as mentioned before, it's a plethora of services, right? And we want persons to engage in not necessarily all, but the most appropriate services for them, right? So that may involve one person going to 5 stations as opposed to another individual that may need to go to 15 stations. But we definitely encourage you guys to come down and have a holistic look at your healthcare.
Let's talk to the patrons, the persons living within Morvant and environs who are coming out to that event. You're saying to them that you want them to come out and engage, but anything else they should know?
Yeah, so what I let them know is that I would like you all to come with some form of something you can write down on, right? Because yes, we're going to be providing you guys with documents saying, well, this is your blood pressure, this is your blood sugar and whatnot. But we want you guys to actually get into health education mode, meaning that when you have a consult with the doctor, he might mention a word. For example, if you're diabetic, he may say, let's do a HbA1c, right? And as a non-medical person, you may ask yourself, well, what is the HbA1c? And the doctor would explain to you the HbA1c is really that diabetes diagnostic test. It tells you whether you're diabetic or not. So as a patient, just understanding those tidbits of information has been clinically proven to improve health outcomes, right? When you have the patient being involved in their health care, we end up having better health outcomes. Right, so what I would say is, guys, come with the idea of retaining information as well. Yeah.
Sounds beautiful. And in that case, you guys can head on down to Lavantille Secondary School on Sunday, the 28th of April from 9 a.m. to 2 p.m. And if you need more information, you can call 627-2087 or 783-2535 for more information on the Grand Health Fair happening on the 28th of April. As the Member of Parliament for Lavantille West, the Honourable Fitzgerald Hines, along with the Morvant Seventh-day Adventist Church, are making sure that you're not just able to be more healthy, but also to be more health conscious. We thank you ever so kindly, Dr. Raj, for joining us this morning once more, giving the insight, providing the service and the support that we need to be a healthy TNT.
Yeah, it's my pleasure.
Best of luck to you on Sunday. I know you're on call and you need some sleep, but for now, we're taking a break here on the Now Morning Show. We'll be back after these messages.